Hello, welcome. My name is Cheryl Lumbard. I'm a certified family and mental health nurse practitioner with over 20 years experience in mental health, mostly providing medication management evaluations and occasionally therapeutic sessions with my clients. What I'd like to talk to you today about is depression. And depression, it's not all in your head. I think most of you have probably heard about the chemical imbalance of depression, especially related to serotonin, and I want to talk to you a little bit about that today. How many of you are frustrated with your current treatment plans? How many of you are suffering what you would call depression? You're not finding pleasure and joy in your life. You're having anger and irritability and find little things set you off, and that's straining your relationships at work and at home. You're having impaired sleep. You either have trouble falling asleep and or staying asleep. You wake up a lot during the night. You feel fatigued during the next day. You don't want to get out of bed in the morning. You don't want to go to work and face your day. You don't want to face your family. You're either comfort eating, you're eating too much to cover up the depressive symptoms, or your appetite's decreased because you don't even think about and don't want to eat. Sometimes you may have crying episodes. You feel guilty or hopeless. If you are engaging in any of these symptoms, suffering from them, whether you're on medications to treat them or not, I need to talk to you and want to talk to you today about functional medicine. Because if you're taking medications to treat depression, such as antidepressants, mood stabilizers, and or antipsychotics, those are treating these symptoms of depression that I just mentioned. They're not getting to the root cause of your depression, so there's only so much they can do. And as we know, a lot of times they're not as effective as we would like, and they can have noxious side effects, such as weight gain, sexual side effects, sometimes diarrhea, constipation, nausea, things that we'd rather not have when we're already depressed. I think we can all agree. So functional medicine gets to the root cause of your depression. With functional medicine, you find out what's causing the depression, you can treat it, you can definitely decrease, if not alleviate, the symptoms of depression. You may still need medication, but you may not. So what happens is we're finding out with many recent research studies that inflammation is the main cause of depression and many chronic illnesses in our body. And all inflammation is your body's response to try to defend itself against something that shouldn't be there, like an infection, an injury, a toxin. So this inflammation causes an immune response to try to fight it. So many causes of inflammation, main cause is stress. We all have stress in our lives, especially now. We're in a dysfunctional world. Stress affects everybody, and of course, some people have stress a lot more than others. Other things that cause inflammation are sedentary lifestyles, the standard American diet, where we eat too many processed, high-fat, fried, fast foods, things like that. Antibiotics, other medications, illicit drugs and alcohol. There are just so many things that can cause inflammation in your body. Being overweight, obesity is definitely a main risk factor for almost every disease, especially depression. So we need to fix this inflammation and find out what's causing it. And very frequent cause of it is something called dysbiosis. And all that means is abnormalities in your GI system or your gut. So a lot of times with that is the bad bacteria overtake the good bacteria. And what happens then is you can have decreased hydrochloric acid, which affects your absorption. So your medications and your foods may not be getting absorbed correctly. Your supplements may not be getting, if you're taking them, absorbed correctly. You can have very difficulties with bowel movements, constipation and or diarrhea. And if you're not eliminating the toxins appropriately from your body, then this can cause this dysbiosis, which is just basically an instability in your GI system. It affects so much in our bodies, and there are so many toxins in the world right now. There are toxins on our foods from pesticides, there's carbon dioxide, there's methane, coal, asbestosis, Roundup that we're in our fertilizing with. We're hearing a lot about this with climate change. So whether you believe in that or not, toxins are present, and they do affect and cause inflammation in our bodies. So what we need to do is treat the inflammation so that we can maintain stability and what's called homeostasis, which is a balance in your gut, if that is your cause. But that's what we do with functional medicine. We find the root cause, be it dysbiosis, abnormalities in your gut, or any other causes. Because I think a lot of you may not be aware that 85% of serotonin and dopamine are actually located in our GI system, in our gut. They're not in your brain, all of them. 85% in your gut. So if you treat that, You can treat chronic illnesses, you can decrease your symptoms of depression, and you treat what's causing it instead of just masking it as a Band-Aid with treating symptoms with these medications. So the treatments are based on whatever the causes of the instabilities are. They can be just changing your diet, they can be increasing your exercise, nutritional supplements, things like that. But there are things we have to find out what the root cause is, then we can offer these other treatments. Like I said, you may or may not have to continue medications, but you're treating the root cause, and you can get rid of your depression or at least decrease it. And isn't that your goal? Don't you want to feel better? And with or without the assistance of medications, find out what's causing your illness, find out what's causing your depression, and you will feel so much better. I'd love to talk to you. I'm offering a 30-minute complimentary phone consultation with anyone interested. Click the link below. We can set a mutually beneficial time, and we can discuss functional medicine and what your goals are in greater detail. I would love to talk to you soon. I hope you all have a great day, and I look forward to speaking with you soon. Bye-bye.